Well, good morning, everybody. Hi, I'm Steve Thorne. I'm the president and CEO and founder of Pacific Dental Services, and I'm here with Rose Olague. We're going to talk about how we can elevate the dental assistant profession. And those of you that have heard me speak in the last couple of years about this know that I'm passionate about helping dental assistants elevate their careers and teach people that are interested in becoming a dental assistant the potential they have in this incredible industry in dentistry, this incredible industry. It is absolutely booming. Rose, why don't you tell a bit of your story real quick as we get rolling, then we'll get into some questions.
Hey Steve, good morning. I want to give Bree a shout out too. We're here live designing a CEREC for a patient that we're helping with Dr. Shea this morning. So
oh, wow.
Sign out with Bree. She's going to get this milled. And by the time I think we're done with this conversation, we're going to have a CEREC ready for our patient. So thank you, Bree. Going to get that milled and then we'll see what it looks like at the end.
Awesome.
But team, so I'm Rose Olague. I'm the manager of DA strategy and school relations at PDS. I'm a practicing RDA in Southern California. I sit on the California Dental Board. I get to work with the PDS Foundation as the mentor for the Dr. Carolyn Gazal DA Scholarship. So my list goes on and on, but it's been a decade that I've been in the career, a little over a decade, and I'm really excited to sit with Steve and talk to you guys about how are we going to elevate ourselves as dental assistants in the profession.
Right, and it's just such an awesome time to do that. Also, dentistry is absolutely booming right now, even through this crisis. We've seen kind of the worst of times in March, April, May, and coming out of that, we're as busy as ever, aren't we, Rose? It's amazing, the demand.
It hit March 16th. I remember I was in Miami trying to get back here. I was visiting our Concord DA students out in Miami. So shout out to you guys and all of our lead assistants in Miami. And I was trying to get back. And I remember telling Erica, am I going to be able to fly back? Are they going to shut down this airport state to state? We arrived 7 days later, I think even less, we shut down offices, dentistry. Sitting on the board, seeing every office across the country, shut down and not be able to provide dentistry for patients. What are the next steps for us as dental assistants when we're supporting clinicians? And I think, PDS did a lot of things with that, Steve. And one of them was teledentistry, if I remember. And I think it got off in 4 days.
Yeah, 4 or 5 days, we were up and running. And there was a big hit then. As I was talking about it with the team, during the heat of the crisis, we were up to thousands a day of teledentistry. It's gone back to a trickle. As you know, we can't make CEREC crowns through the video, right? And so it's changed back, but it's a great tool still there. Tell me about what it was like, because you're right, it was March 16th. March 16th, we went to skeleton crews across the entire network of the PDS organization. What was it like for you as a dental assistant to work during that time and just help out everybody across the nation? Because we went to skeleton crews, people were nervous and all sorts of things. Talk about that.
Yeah, I'm not going to lie. I was nervous as a dental assistant too. You're coming in, you don't know what's going on entirely with COVID. Who has it? Who doesn't have it? We still don't know that. I think what happened, what I'm so appreciative of, is we have our clinicians, we had PDS leadership team that were, in my eyes, what I'm learning from COVID: transparency, ongoing communication, and the collaboration is going to have to be there with us. Right. And that was everything from PPE, N95 mask and KN95 mask. We're going on the news that there's not enough. You're going to have to reuse. As a dental assistant in the PDS, team, we didn't have to worry about that. The N95 masks, surgical gowns, booties, bouffants, they were all there to help us support our patients and our clinicians. And that was the biggest thing in transparency I did when we worked with the dental assistants. The PPE is going to be there.
So let's hit on that for a minute. So during that crisis, there was a lot of fear, and yet when you were talking to it was probably 1,000 or 1,500 that were working during the peak of that crisis, right? How did they feel? Did they feel like they had enough protection? And I can give the answer post now, looking back 6 months, but during that time, talk about that.
Yeah, I mean, it's going to depend who you talk to in the market. Steve, you know that. I know for our dental assistants and the dental assistants I collaborate, inside and outside PDS, we did have the PPE. I sit on the board, so I also collaborate with quite a few clinicians that have their own private practices. And their dental assistants I work with very closely now with. And it was challenging for some offices to get the PPE. And that is what I think, I don't want to use the word fear ever, because we bought into the healthcare. Any patient walking into the office can have X, Y, or Z and not share it with us.
Anytime, right.
It happens. Right. And that was one thing that I really stayed focused on with our team, and making sure we have ongoing communication. And it's throughout the day. When we were in the peak of it, it was something can change that got posted in the morning at 6 o'clock East Coast time. By 12 noon Pacific time, the law, a new regulation, the healthcare department, something's coming in. So that communication and the ongoing text message. I heard from multiple dental assistants in the community that they hadn't heard from their clinician or their team about what was going on, but they were no longer working. And I think that's where the change has to be made. That ongoing communication with what is going to happen next needed to be there.
I think you hit on a couple things there. So number one is one of the things we did, and I know other big organizations did too. We went out and bought just a ton of PPE. We spent millions of dollars between March 16th and the end of the month to make sure you guys were all protected. So we had it available when I know so many smaller practices did not. I think it's another reason why large group practice is growing in America. There's so many reasons, but that's another one. We're going to get to the career path in just a minute. But another one is that dentistry is a safe profession, right? We know this stuff. And I kept talking to our team about that. We lived through the AIDS crisis in the late 80s and 90s. Many of us did. I know you were probably just being born about then, but many of us lived through that time. And dentistry, dental assistants, hygienists, they are exceptional at PPE. They're exceptional at staying safe. And the facts have proven that out. As of now, we've had millions of patients visits since that time, and we haven't had one transmission between a patient and a clinician, patient and a dental assistant, or a dental assistant and a patient. Now, we've had some transmissions, I call them break room transmissions, where people remove their mask or they weren't quite as safe, but we've had nothing serious around the company. But we haven't, in the operatory, you guys are safe, right? It's a safe profession.
No, and I think that's it. You have to know your donning and doffing process. And that was my biggest question to the clinicians on how are we going to train this down? So we have the PPE, the support is there, but now you need to train it down to every dental assistant and our DA students. Steve, schools were running. The DA programs were in full swing. Kudos to them to going hybrid, taking their curriculum online, and then we needed to support them with externship and the hands-on. So we have to train it down on the spot when we're learning at the same time. So that's another thing, we really stress the process of revisiting the conversations with donning and doffing when it comes to compliance.
You don't normally think of that in day to day when there's not this pressure of this coronavirus, this pandemic going on, but really we should be doing that every single day, right?
Absolutely, from start to finish. I mean, you saw me and Bree, we're right here 6 feet within each other, and we have our masks on. We're working with each other. Those are basic things that have to be done to ensure the safety of everyone in the practice and our families at home. It goes beyond that.
Yeah, so I think part of this, the message is, hey, dentistry is a very, very safe profession. Dental assisting is a very safe profession, and we know how to stay safe. So I just want to make sure that message is loud and clear. Now, let's get to the technology. So you're doing a CEREC there. What's your favorite part in the last few years about the technology advancements in dentistry? Obviously CEREC, but what else?
Yeah, CEREC was one of them. I think cone beam, so the x-rays or CBTC scanning. When you're doing an implant case, I'm very fortunate. I get to work with specialists, the clinician that I get to collaborate for the last 13 years with, Dr. John Shea. He was a big fan of implants and always developing his dental assistants on the latest technology. So now you get to be a part of that journey and see how it's, implanted, integrates, and you go to the finished result. So I'm a big fan of implants, Steve, hands down, but I think something else with technology, which I just became certified in, so thank you to you guys and your team, but it's Epic. Learning a new charting system and bringing in and collaborating now with healthcare professionals at Kaiser and seeing a whole medical history from a patient and being able to now have a conversation with our clinicians on what does this look like when this patient's coming in for dentistry.
So talk about that. What gets you excited about it's basically to a lot of people, they think it's just a new practice management system, kind of a big database, right? But it's way, way more than that. You and I both know that. What gets you excited about that as a dental assistant? Expand on that a little bit more.
And I have a question for you, Steve, that's been asked of me quite a bit when it comes to this. The mouth-body connection is, we're big advocates of that. And one thing I'm learning with Epic is you get this maybe laundry list of information from the healthcare. Not everything's going to transfer over. You don't need everything to transfer over, things that are relevant. But when we're talking about the mouth-body connection, how as dental assistants can we support our clinicians with that? What is our role?
So much. Okay, so here's a practical answer to that. We know what happens when after the dentist does their diagnosis, or we can even go to hygienist, okay, but mostly the dentist does their diagnosis, and when they leave the room, right? We coach dental assistants to stay in the room once the doc leaves, right? Okay, there's a reason for that. What does the patient do?
They turn to us and ask.
Yeah, they turn to you and ask questions. So we know that happens. So you can support the mouth-body connection and the oral systemic link by being educated on the subjects, right? Whether it's brain health or vascular health or mental health, so that you can talk to the patients about how the mouth is the gateway to the health of the rest of the body, and you can engage with that patient right there. So the education is a key component of it.
Where is one resource, Steve, if a dental assistant can go to find an article or has that ongoing education, especially for mouth body, that you would recommend?
So we for us in our network, we have a bunch right online in our system. But I'll tell you what, there is so much out there right now. There's not just one place. You can just Google it and you'll find it, or YouTube it, and it is there. And there's a plethora of information. You can also, we're working on building up Smile Generation the information under Smile Generation, but we also have it on our office websites. It's all over. Walk into one of our new offices, our next gen offices that we're just starting to begin building, and you can just pick up the flyers right there.
I heard one of our Nevada offices has a whole wall, a virtual interactive wall with mouth-body connection, with Theric. So I know that's going to be, when it gets here in California and across the country, it's going to be exciting for our patients to be able to interact live with the wall. It's moving and active with that.
Right. And what happened was, is the year 2000, the U.S. Surgeon General said, look, we cannot have good overall health if we don't have good oral health. And that began a process back in 2000 of science and looking at the science and the data of the oral health, whether it's the bacteria, periodontal bacteria, or just decay, perioabscesses, endoabscesses, implants, you mentioned implants, all those things, and how they affect the overall health of the patient. And the amount of science and research and data that's happened in the last, we'll say mostly 10 years, last 10 years, it's unreal. It's absolutely unreal. You connect the dots. We have we have a lot of great bacteria in our mouth, but we have a lot of bad bacteria that have been proven to cause atherosclerosis and heart disease and other problems. They've now identified the actual bacteria that causes dementia and ultimately leading to Alzheimer's. They've definitely correlated to preterm births So especially for women in the early stages of pregnancy to get their teeth cleaned. They've even recently found that it has lowering the bacteria levels in the mouth. If you have high levels of bad bacteria, that it can lessen the severity of the coronavirus if you get it.
There you go.
Great paper out right there. Dental assistants want to research it by Dr. Victoria Sampson out of England. You can find it online. If not, text Rose or email Rose. We'll make sure you get a copy of it.
You can DM me, dental assistant.
Yeah,
you know I
we'll
respond.
get it to you. But yeah, it's just super powerful. And what we're also seeing is the dental medical integration happening with the larger carriers, understanding that they need to provide benefits for patients, not only on the medical side, the dental side. So all of that is starting to come together. It's a little bit slower than we all want because dentists work in a different coding system, but even that is starting to change, right? You guys learned the CDT codes probably in dental school. Well, the medical profession works on ICD, I think 10 now. And so we have to cross code and learn all that, but all that's happening right now.
Wow. I mean, so much has changed even from when I started. I mean, that was in one of your offices in Rancho Cucamonga with Dr. Carolyn Gazal. And I remember some of the technology we were working with back then, it was like a wheelhouse, not moving. And now to see where we've gone with our charting system and where we're going, it's very exciting. Yeah. We as dental assistants get to be a part of that change. I'm now talking to my nurses, MAs, and they're like, Rose, we've been on that. I was like, well, guess what? We're one of the first. I think that's what's so exciting when I'm working with my peers as dental assistants. They're like, epic, Rose, what is that? I was like, let me tell you, it's really epic.
It is. Yeah, I tell people it's like going from driving a Honda Civic to a Ferrari or a Maserati. It's just that much more powerful. And that's what we're experiencing. And we're only in the beginning stages, Rose. You know, we just started a couple months ago, but we're in process. We'll have 100 offices on it by the end of the year. By the end of next year, we hope to have 700 offices on it. So it's just going to absolutely explode. I really believe dentistry is at the beginning of a new technology boom. And so what an epic time, excuse the pun, epic time for people to get involved as dental assistants. And dental assistants also, I want to get to the career path now, dental assistants and what they can do in the career. They may start even as an intern. Did you start as an intern?
Yes, I did. I did start as an intern, and I can tell you my first day, I was dropping suctions. When I was mixing a cement, I still remember I exploded it like I was baking a cake on my dock. And it was literally like a smoke ball in front of him. And then x-rays were not that easy. I was a 30-minute x-ray girl. Which,
you probably had film back then, huh?
Yep, exactly.
Lovely. So talk about the career path. Do you tell your story? And then I want to talk a little bit about the career path for dental assistants too, so we can kind of expand our thinking about how dental assistant can be such an incredible entree into this incredible profession that next year it's going to do almost $160 billion industry. Okay. I mean, it's a massive industry and we get to help people. So tell your story a little bit.
For all the dental assistants out there, and, thank you for joining. We see the, comments coming in from DFW, San Antonio, Florida, Massachusetts, California. We're so excited to be with you today. For those that have not met me in person, I started in the industry when I was 17 years old, and I was in high school. I was getting ready for prom, graduation. I wasn't thinking about where my career was going to go or if I needed benefits or what I wanted to do. I was excited to graduate high school and then to go into college. And I think that's where it really changed. I was working with patients on a daily basis that were connecting with me and loved and adored me as a dental assistant. So loved and adored me, but they loved and adored the role I was playing in their dentistry as a dental assistant. So from there, I went on, became a registered dental assistant in the state of California. That's our career path here to go in. We take our exams, we become a registered dental assistant. But then in PDS, you can go a little bit further if you want to stay on that path of dental assisting. And I became a lead dental assistant. Spent 7 years there, loved it. But now I would want to
So
see,
talk about that role real quick though, because a lot of people might not, sorry about the background noise. What does it mean to be a lead dental assistant? To just real quick, because it's a
so
big
now
job.
I am working with what we've referred to as the Trinity of Dentistry. A great owner, or not great, phenomenal, because I got to work with a phenomenal owner doctor, so not great, a phenomenal owner doctor, and a phenomenal office manager who still support me, and I know are on this call today. So shout out to them for thank you for that support. I worked with them on now how do we build a practice. It wasn't de novo, Steve, or what we call de novo. And it was not heavy, patient flow was not there in the beginning. You're ramping up a practice, it's day one, you need to build your brand in the community. So I was a part of that building of that brand and bringing patients into the practice. You name it, I did it as a lead assistant. From developing my dental assistants, developing associate dentists that were coming in as new grads and working with them hand in hand.
A lot of people would laugh at that one. Developing the dentist, the new dentist, a lot of people get a kick out of that one. Yeah.
I think one thing with the pediatric side, we added specialty. 2 years in, we added specialty. Pedo came in. I placed the tooth fairy in the local community. So I was the tooth fairy, and now you got to see your dental assistant. And kids were like, my dental assistant's a tooth fairy, Mom. That's right. And that grew as our patient flow, what we were in the community. So it was not only, it's not ordering supplies and budgeting. That's a task that we do. In the lead role, you're developing talent, you're fostering talent, and you're owning your own development. I think that was key for how I was going to move on next.
Great.
Because I got to then complete my undergrad at La Sierra University, was going to school full time. So PDS helped with that too as well. And I had an owner doctor that supported it, going to school full time, working full time, but I was there. The morning, midday, afternoon, I was still working full 40 hours a week and going to school. Still don't know how I pulled it off. We move forward and I meet Joanna Rogers and a team of now phenomenal owner doctors in a region that I get to support 70 back offices. Wow. And that's our regional back office trainer and manager role, Steve. And now I got to go to see Corona World. I got to go to Iva Clark's training center in Buffalo, New York, where clinicians go and learn the technology hands-on. What other organization can you go and have that level of training? Then master's comes. Let's get a little bit more education under the belt. I'm still growing up this ladder and I'm not done. And then I get appointed to the California Dental Board by Governor Brown. It's been a phenomenal ride of, sky's the limit, but I asked for the support and what else can I do? How can I help you? And I'm the yes girl. I don't say no to an opportunity. I will be there and I'll find a way to get there.
So let me ask you this, what's next? You continue to rise up.
So I have some exciting news to share with you, Steve, and this kind of just happened. I got accepted into a PhD program at La Sierra University. So we'll see. It's going to be a journey, but it's brand new news to me. I'm very grateful for now the doctors that I get to collaborate with at La Sierra University. But a PhD may be what we're speaking to 4 years from now and celebrating.
Well, if I have any input, study the mouth-body connection.
That's a research project.
That's your research. So congratulations on that. That is absolutely awesome. So there's also other opportunities for dental assistants, right? They can once they learn the kind of the back of the house, so to speak, right? They can move to the front of the house if they want. Talk about that, because a lot of dental assistants have taken a different career path and gone the other way, more on the admin and business and biz development and that.
So yeah, and that was a career path that I was presented with by one of my regional managers. And it was really going from that lead dental assistant role and now taking my talents as a dental assistant and going into a BC or a benefits coordinator or a specialty benefits coordinator. And going from there and then into what we call an office manager in training and then an office manager. Right. That's a development when you lay it out. And that's one thing me and my regional manager always talked about management was, what does that progress look like? 6 months, 12 months. And that's something I really want to share with dental assistants. It doesn't happen overnight. You don't wave a wand, 90 days later, you get a new title. It's steps and stepping stones you take to get there. but you're going into that admin house. I could not be on a phone, Steve, so I couldn't do that. Like picking up a phone and taking insurances, not my forte, but I have worked with great DAs who do it and they excel at it, because now they're taking that back office knowledge and being able to treatment plan a case for their clinician and collaborate there and go ahead and put it in front of their patient. And they know all the terminology right off the bat. Why wouldn't you want a dental assistant to be your office manager?
Right. Dental assistants with good administrative skills and that drive for the business side, they make incredible operations managers. Incredible. There's different paths. I'm not saying one's better than the other. You chose your path. It's awesome. You're skyrocketing. And then there's the other path too. That's so many. So the opportunities for the profession of dental assisting they're just amazing right now. Absolutely. They can go, there's one other area they can go in an organization like ours, which is into more on the support side too, right? On the support level, you're kind of in there in between the support level and being on an accounting team, on a finance team, on a marketing team, wherever they want to go once they've learned the profession, huh?
Yeah, no, I completely agree. And one thing I want to kind of toss in there, Steve, is staying chair side. PDS has a phenomenal platform for that too, because you're elevating your personal and professional skills. Personal skills, your professional skills, and your clinical. You can add additional certifications. Do you want to do specialty? Shout out to all our OS, our perio, our endo, ortho. You guys took it a step further and wanted to specialize in providing patient care when it's putting on brackets and banding a patient same day.
Right.
I know I can't do that, and I'm grateful for the DAs who do have that talent in them, because that's truly unique. And then our OS assistants, putting an IV in for the additional certifications and going in, you're helping your clinician. We're seeing more patients and being able to provide more dentistry for that community because you added that certification to your belt.
Right. I call it expanded function. So in my lifetime in career in this profession, 32 years now, the role of the dental assistant continues to be able to do more things year after year. Maybe it's slow, like you just said, those different roles, the different titles, different degrees. I call it expanded functions. They can keep going more and more, and I don't think that's going to stop. There's going to be a lot more available for dental assistants who want to be in the practice of dentistry and just be exceptional dental assistants. So much opportunity for them. So I want to encourage that too. So again, so many paths for dental assistants to go after. What do you think? Let me ask you another question here. What do you, when you think about the role, the profession of dental assisting, what do we need to do to elevate it so we attract way more people to the role of dental assisting?
So see, you get transparency with me. Many of the people on the call know that you get transparency with Rose. One thing, I have two big things that I'm really focused on in the industry too as well. Working with managers or any type of management to help articulate that career path for the dental assistant, wherever they want to go. That's one thing that I'm constantly working on and speaking to. And
can I make a comment on that?
Yeah,
I love what you just said. It's the way I teach it too is you're not joining my journey. I'm joining your journey. My job is to help you excel and grow. And that communication between the dental assistant that just came on board, it could be even an extern that just came on board, that conversation between them and that operations manager to help them elevate their career is so important. I want to encourage everybody out there to continue to do that. So I want to double click on that because it's so important.
And absolutely. And then the next thing, a lot of dental assistants text me, DM me, whatever communication they want. But the other thing we're really focused on is compensation and ensuring that, the broadband is appropriate for our profession.
Right.
ADA does articles on this. There's tons of dental assisting communities and networks. DA, Rockstar podcast. There's that collaborate, what does that broadband look like for a dental assistant at each level of their development?
Right.
And I think that's a key component too coming in. It's not that this dollar is at this stage, it's an ongoing conversation to take you from $1 amount to another dollar amount, and then to keep your job, to keep the conversation going and ask. And that's one thing as dental assistants, we really want your support in, Steve, of how is that kind of conversation is ongoing and evolving as each year comes.
Yeah, and you and I know that we agree on that, and we need to work on how we elevate that career path and the financial career path for the dental assisting profession for sure, all throughout the industry. So it starts with employers who pay for dental plans. It goes to the dental plans who pay the fees, patients who pay the fees, and the overall financial impact dental assistants can have. One of the things we've seen right through this crisis is that we can do a lot more with less. And when we do that, it frees up money that can be paid to dental assistants. I totally agree with you.
And then the last one, Steve, is, when I say industry affairs, I'm speaking to boards and dental assisting councils, getting DAs involved in that part. I was in Tennessee, this was about a year ago, and I remember one of the schools and some of the DAs I was collaborating with were, Rose, how did you keep a dental assistant council going in California, where they really are the advisors to the dental board for recommendations of what needs to happen with, certifications, expanding the clinical, scope of a dental assistant in California, because in Tennessee, it had dissolved or was no longer being appointed to the dental assisting council. So that's really another thing I strive for now, sitting on a board. I'm still learning, I'm only 2 years in. The lingo is like a foreign language to me some days. I'm sitting on there like, what did he just say? And I'm looking to Dr. Morrow or Dr. Stewart. I'm like, can you whisper in my ear what that was? So I think that's the other piece of it too, getting involved also on the dental boards, associations, and dental assisting councils in your community so we can create that change.
I think there's a whole nother level coming your way too, Rose, since you are so passionate about this. It's getting, as we move towards the dental medical integration, I'm going to throw one out there for you. We're going to be moving into a whole nother realm of overall health for patients too, not just their oral health. And I really believe dentists can play such a critical role in primary care, healthcare for the future of people in the United States and the world, and that dental assistants will play a vital role in that whole spectrum of changes that are happening. It's super exciting.
No, I absolutely agree, Steve. Steve, we have one question that was from our dental assistants across the country. I wanted to share, just ask you to kind of wrap up. But the question was, right now during this time, we're working in a pandemic. We are.
Right.
What are 3 tips you give that dental assistant? Let's go with entry-level dental assistant entering the industry. What 3 tips could you give them to have success? And then let's go our 10 years or our 5+ year dental assistant. What tips or 3 tips would you give them?
Well, I think right now, for all 3, the first one, since we're in this pandemic, we don't have a vaccine, we're getting better and better at the medical cures. The first thing is be safe. Be smart, be safe. Make sure every single person that walks in that dental office gets the proper assessments, gets checked, gets their temperature checked, all of that. And then make sure, like you said, that the proper PPE is worn and how you're taking it on and off and all of that. So first thing, be safe. Second thing, it's just an amazing time to learn. We are at a technology boom in dentistry. So whether it's CEREC, whether it's implants, like you said, implants are skyrocketing in the United States, whether it's dental medical integration, whether it's like the new periodontal care that's supposed to be done out there in the United States. They changed the periodontal, the American Periodontal Society changed the way periodontitis is supposed to be treated. I think it was 2018, and how we get that implemented out there. They changed the categories. And so how do we do that? Engage in the changes that are happening and help out in that. And then I think for all three too, that point you made about talking to your operations manager and your dentist about where you want to go in your career, I think is so important. I just want to remind all of us that are in the leadership positions that our job is to help them in their journey of where they want to go. You've had a lot of people help you out. I know you know that, Rose, along the way, but you also raised your hand, said, I want the help, and spoke up. And so you get people like Dr. Shea and Joanna Rogers and others. I'm sure I'm leaving out a bunch of people on that list that have given you the path on the way up. Yeah, you had to ask for it and go for it. So I think all three of those at each level, just so important.
And then Steve, before we take off, there's one question in the box, and I love this question, so thank you for asking it, but it says, how does PDS provide recognition to their DAs? It's a great question for one of our dental assistants.
Well, I know at XP, we have the XP Awards for dental assistants, right? So that's probably the biggest one. And so
yeah,
I can't
let's
remember.
hit on XP.
You got an award. What did you get? What award?
Yeah, I was an XP winner.
How high?
And, yeah, so I got to go, dental assistant shout out, I got to go to Vegas, had a phenomenal time, but I got some continuing education on top of it. You know, and extraordinary performers are recognized in Pacific Dental Services, and it's not just one dental assistant. It's anywhere between 10 to 15 dental assistants that are recognized out of our 5,000 dental assistants. So it's quite an honor, but that's only one way that we recognize. As we celebrate Dental Assistant Recognition Week with all of you guys across the country, it's coming up here in March again, as we enter, 2021. That's a week-long celebration of from goodies to snacks to gift cards to, shout outs to dental assistants. We, as PDS, have a pin. And now for the last 3 years, so if you are familiar with Disneyland style pin, it's now showing to how long the tenure you've been with the organization, and you get to wear those pins proud of, it started here, and I'm gonna have 20 pins one year. So it goes beyond that. And I think it's also, you have a national recognition for dental assistants, regional, and then in your office.
That's what I was going to say. Regional, there's regional recognition awards, and I believe we help in education. And I know we think we did some of that for you, help in the education process and that whole process. I don't know all the details, sorry, but I'm sure Rose does.
Now, Steve hit on tuition reimbursement, and I did leverage that. Tuition reimbursement is a huge way for.
I didn't want to say something out of line and have Joanna beat me up after the call.
No, tuition reimbursement is another thing, because a lot of organizations, Steve, don't offer that. And you guys were able to support me. And paying for your education is challenging. And I think, we also collaborate on the PDS Foundation side with the Dr. Carolyn Gazal, helping dental assistants that are currently in school with the scholarship. So not only in PDS, but on our foundation side. So we're helping you.
40 scholarships this year, right?
40 scholarships. Our next round, so November 1st, so any dental assistant student on this call, apply away. November 1st is our last deadline, and we'll be awarding our last scholarships of the year. But that is a phenomenal program to be a part of and to be selected as one of those DA students. And we look forward to seeing all your applications come in November, because I'm a part of that committee and I'm the mentor for that scholarship. So
you probably get to choose. Yeah, great. Okay, it's so fun to talk to you, Rose. And once again, you're doing an amazing job. And it's so fun to hear your career growth, your career path, hear your passion about the dental assisting profession. I want to encourage everybody on this video to continue to elevate the profession. It is such an amazing time to get into dentistry, such an amazing time for people to get into the dental assisting profession. and I want to encourage that. So thank you, Rose. It was so fun talking to you. Any last words you want to say?
Oh, thank you, Steve. I think back to the 17-year-old me. Who would have thought I would be sitting with the CEO 13 years later talking about the profession of a dental assistant? So thank you. I'm very humbled to be able to have some time with you today, and us as dental assistants be able to speak to you.
Okay, well, thank you very much, and let's keep pushing. We want to keep pushing for the industry. Somebody needs to lead the industry. It might as well be you and I. So let's do it.
Well, why not? On both sides. Let's go. Let's take it on. We're strong to finishing 2020 strong, and so let's start a 2021 in a different way.
Yeah, and we all want to forget about 2020 once it's gone. Get this virus behind us. So thank you very much. You guys all have an awesome day, and it was really a lot of fun today. See ya.
Thanks, DAs. We'll talk to you soon, everyone.